Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, I am Dr. Mahmuda Sultana Shumi, Associate Professor at Sakina Women's Medical College, Jashore. Today I am going to discuss about the histology of respiratory system. In my first class, already I have discussed about the initial portion of the respiratory system. Now I am going to discuss about the trachea. The trachea is a thin walled tube that is 10 to 12 centimeter long and 2 centimeter in diameter. It is extended from the base of the larynx to the point at which it bifurcates into two primary bronchi. The wall of the trachea consists of mucosa, submucosa, hyaline cartilage and adventitia. The mucosa lined by the respiratory epithelium of 5 cells, ciliated columnar cells, goblet cell, small mucus cell, granule cell and diffuse neuroendocrine cell and basal cells. The basement membrane is very thick layer of the elastic fibers that lies beneath the epithelium. Lamina propria is a thin layer of loose fibroelastic connective tissue that lies beneath the basement membrane. It contains lymphoid nodules, lymphocytes and also mucus and seromucous glands. Then submucosa. Submucosa is a layer of dense irregular fibroelastic connective tissue. It contains numerous seromucous glands. Lymphoid elements are also present. Then next layer, hyaline cartilage layer. Hyaline cartilage layer formed by a dozen of C-shaped ring of the hyaline cartilage between the submucosa and the adventitia. Hyaline cartilage is surrounded by a dense connective tissue, perichondrium, which merges with the submucosa on one side and the adventitia on the another side. The open ends of the cartilaginous rings are breached by a bundle of smooth muscle called the trachealis muscle. Then adventitia. Adventitia, outer fibrous coat consisting mainly of the elastic fibers and contain numerous nerves, blood vessel and adipose tissue. In a short, the trachea contain 4 layers from outside to inward. Mucosa lined by the pseudostratified columnar epithelium, submucosa contain the seromucous tracheal glands, hyaline cartilage in C-shaped ring. The gap between the posterior end of the hyaline cartilage is filled by the trachealis muscle and outer fibrous coat adventitia contain mainly the elastic fibers and contain numerous nerves, blood vessels and adipose tissue. Then trachea, next to the trachea, this is the bronchial tree. And the trachea bifurcate as the right and left primary bronchi that enter the hilum on the posterior side of each lung along with the pulmonary vessels, lymphatics and nerves. Bronchial tree, that means the primary bronchi course downwards and outward, giving rise to 3 secondary bronchi, that means lower bronchi in the right lung and 2 in the left lung, each of which supply a pulmonary lobe. These lower bronchi again divide forming tertiary or segmental bronchi. Each of the tertiary bronchi together with the smaller branches, its supply constitute a bronchopulmonary segment. Approximately 10 to 12% of each lung with its own connective tissue capsule and blood supply. In a cross section of a large bronchus, the lining of respiratory epithelium and the mucosa are folded due to contraction of its smooth muscle. At this stage, in the bronchial tree, the wall is also surrounded by many pieces of the hyaline cartilage and contain many seromucous glands in the submucosa which drain into lumen. Bronchus lined by pseudostratified ciliated columnar epithelium with a few goblet cells. The lamina propria contain the distinct layer of smooth muscle surrounding the entire bronchus. The submucosa is the site of the supporting cartilage. The adventitia contain blood vessels and nerve. The tertiary bronchi give rise to smaller and smaller bronchi, whose terminal branches are called the bronchioles. Each bronchioles enter a pulmonary lobule where it branches to form 5 to 7 terminal bronchioles. Bronchioles are the intralobular airway with diameters of 5 mm or less than this, formed after about the 10th generation of branching of the bronchial tree, have neither cartilage nor gland in their mucosa. A large bronchiole has the cartilage, characteristically folded respiratory epithelium and prominent smooth muscle, but is supported only by fibrous connective tissue. In the larger bronchioles, the epithelium is still ciliated pseudostratified columnar epithelium, but this decreases in height and becomes ciliated simple columnar or cuboidal epithelium in the smaller terminal bronchioles. Goblet cells disappear during this transition, but the epithelium of terminal bronchioles instead contain other numerous columnar cells, the exocrine bronchial cells commonly called the Clara cell. Then respiratory zone. Respiratory zone started with the respiratory bronchiole. Each terminal bronchiole subdivided into two or more respiratory bronchioles that serve as region of transition between the conducting and respiratory portion of the respiratory system. The respiratory bronchiolar mucosa is structurally identical to that of the terminal bronchioles, except that their walls are interrupted by the opening to sac-like alveoli where gas exchange occurred. Portion of the respiratory bronchioles are lined with ciliated cuboidal epithelial cells and Clara cells, but at the rim of the alveolar opening, the bronchiolar epithelium becomes continuous with the squamous alveolar lining cells. Between alveoli, the bronchiolar epithelium consists of ciliated cuboidal epithelium, although cilia may be absent in more distal portion. Smooth muscle and elastic connective tissue lie beneath the epithelium of the respiratory bronchioles. Terminal bronchioles branch into respiratory bronchioles, which then branch further into alveolar duct and individual alveoli. Alveolar duct, that means respiratory bronchioles, branches into tubes called the alveolar ducts that are completely lined by the opening of the alveoli. Both the alveolar ducts and the alveoli are lined with extremely attenuated squamous alveolar cells. In the lamina propria surrounding the rim of the alveoli is a thin network of smooth muscle cells which disappears at the distal end of the alveolar duct. A rich matrix of the elastic and collagen fiber provides the only support of the duct and its alveoli. Alveolar duct open into atria of two or more alveolar sac. Elastic and reticular fibers form a network encircling the opening of the atria, alveolar sac and alveoli. The elastic fibers enable the alveoli to expand with inspiration and to contract passively with expiration. The reticular fibers serve as a support that prevent over distension and damage to the delicate capillaries and thin alveolar septa. So, thank you for all. Allah Hafiz.